Good afternoon and welcome to the Public Health Network Cymru's webinar series, Prynawn Da a Croeso Pawb. My name is Liz Green. I'm a consultant in public health, policy and international health at Public Health Wales, and I'm Programme Director for Health Impact Assessments. Today we are focusing on the issue of food security, something which few of us will consider really until it actually affects us. And during the pandemic, we've seen panic buying and supplies diminish before our very eyes. And now we're seeing a cost of living crisis with the impact on everyone as prices for food and food supplies are rising. So food matters, as we know. It's a basic need and a human right. And food security is something that the Wales Health Impact Assessment Support Unit, which I'm Programme Director of, we carried out a piece of work on the impact of COVID-19, Brexit and climate change, all combined to look at the cumulative impacts of those events on food security and also who within the population would be affected. And that included people on low incomes, children, young people, lone parents. And we also found and saw that actually food security consists of a range of factors: utilisation, accessibility, availability, but we have to have stability as well. So I'm no expert on this matter, but I'm pleased to say that today we do have some excellent presenters who are. So we have Zina Lopez, and she's Head of Strategic Delivery at the Food Standards Agency. And Zina is leading the agency's work on the cost of living and focusing on household food insecurity. Then we have Dr. Angelina Sanderson-Bellamy. And Angelina is Associate Professor of Food Systems at the University of West of England in Bristol. And Angelina is an ecologist, and she's passionate about researching ways to transform our food systems to be sustainable, healthy and accessible for everyone. And Angelina has lived and worked in California, Sweden and the UK, and she's done extensive research across the UK and Latin America. And then we have Chris Nottingham. And Chris is Sustainable Food Coordinator at Bainai Gwent Food Partnership. Chris began his food journey in hospitality industry and is a trained chef and kitchen manager. And he worked at award-winning restaurants and bakeries. And his passion led to studying a master's in sustainable food and natural resources at the Centre for Alternative Technology in Wales, and has led to a research project on food environments and their impact on public health. So that's the presenters. Thank you very much. Really looking forward to hearing what you have to say. So just for all the participants and the attendees, we have a few housekeeping rules. So after the presentations, there'll be a chance for you to ask questions. We have the chat box. And so if you type your questions in there, then the Public Health Network Cymru team will pull them together and we will ask them at the end. The webinar is being recorded and will be made available on the Public Health Network Cymru's website after the session. For those who speak Welsh, first language, there are some subtitles available, and you can switch those on using the button at the bottom right of your screens. I will say, I'm sorry, we are aware that the Welsh auto-generated subtitles are sometimes slightly inaccurate, so do apologise for that, but we have got that ability and that function if you require them. And then finally, if you experience any difficulties with the technology, please let us know in the chat box and the team can contact you directly. So without further ado, I'm going to pass on to Zina, and I look forward to hearing from you all. Thank you.
Brilliant. Thank you, Liz. Let me just share my screen and hopefully this works as beautifully as it did earlier. Hopefully it should be loading now. I introduced myself quickly while it's loading. So hi, I'm Zena Lopez, as Liz said. So I work for the Food Standards Agency, and I'm leading our work looking at sort of how we respond to the cost of living crisis, sort of specifically when it comes to households. So I'm trying to work out kind of what our current approach should be and the levers we could pull to try and expand our activity on this quite difficult issue. I will say that food affordability is, of course, has many dimensions and on the whole is caused by poverty, which of course is not in the remit of the Food Standards Agency. But we can and believe, however, that we should be looking at how to mitigate the consequences of food insecurity. So that's what I'll be covering today. A quick sort of background on sort of who we are. So the FSA is an independent non-ministerial department established in 2000 following several high-profile outbreaks of foodborne illnesses such as mad cow disease. We work across England, Wales and Northern Ireland and work really closely with the Food Standards Scotland as well. We have two main objectives in law: to protect public health and to otherwise protect the interests of consumers in relation to food. So this includes the way food is produced or supplied, and it's kind of this latter bit which has meant that we can try and expand our work looking at sort of household food insecurity to try and protect the interest of the consumer, because shockingly a lot of our research finds that people really care about being able to afford and eat food. We have three objectives in our strategy, which household food insecurity cuts across all three. So it means the consumer potentially compromising on food being safe, and their choices may change to accept substandard food, which may not be what it says it is. For example, we're seeing increasing reports of food being sold online in multiple languages with no traceability or safety checks. So there's no way for the consumer to understand what's in their food. And often, of course, the more affordable option is not always the healthiest. So the House of Lords Select Committee on Food Poverty, Health and the Environment have some research showing that healthy food can be 3 times as expensive as less healthy food calorie for calorie. So with this in mind, we have approached household food insecurity with our 5 strategy roles, which are up on the screen there, to understand how and where the FSA can best take forward actions which are under our remit. For example, we can generate and publish evidence under our protecting the consumer interest statutory duty, highlighting the issue for the rest of government and indeed civil society to pay attention to. So that's who we are. So to be able to gauge what the FSA can do in this area, we've done some research understanding how the consumer is changing their behaviour as kind of the cost of living and food insecurity increases. So once we know this, we can understand how the rest of our work will kind of change as the context around it changes. So unsurprisingly, it's understandable that those who have very low food security have different food behaviours. Our research found that trust in the current UK food safety, hygiene and standards is lower for those in low or very low food security. There's more concern and sense of risk from low income participants on safety, hygiene and labelling. These participants also seem to feel more exposed to poor quality, to poor practice, alongside having concerns about allergens and labelling and more confusion about what's in my food. All these stats reinforce that those on a lower income or who have very low food security are prioritising different things to those in a more fortunate situation and are making or having to make different choices. If we know people are behaving differently, the question for the FSA is how can we ensure that our advice still supports them? This is especially true because the number of people in this group of people in low food security is only going to grow. So if I go to the next slide, we can see, so this is kind of the latest data. And hopefully, yeah, you can see that we've kind of pulled Wales out as well, so you can kind of see the breakdown across the UK. So 1 in 6 consumers are classed as food insecure based on our research conducted between October 2021 and January 2022 this year. Given the past 9 months, it's very likely that this has increased quite significantly. So interestingly, you can see the picture's fairly similar across the UK. The dark red kind of shows where it's kind of more concentrated. But actually, Wales seems to have slightly more people being classed as very low food security. But however, perhaps interestingly, food insecurity has increased in both Northern Ireland and England between this wave of research, so October to January, and the wave before, so April to June 2021, but this wasn't seen in Wales. So, well, between April and June 2021, it was still at 17%, whereas in Northern Ireland and England, I think in England it was 15% a year ago. So I thought that was relatively interesting. Before anyone says anything, I know the numbers don't quite add up. I promise that's due to rounding, but I'm very happy to send around the report that kind of shows these figures. And also, I can't share them today as they're not published, but on the 10th of October, we should be publishing a new set of figures which kind of tracks monthly the number of people saying that they've used a food bank, saying that they haven't been able to afford food in the last month, and stats like that, which are really, really interesting and really show a real trend of increases. So that should be published in October. And we're also looking to try and capture how people are changing their food behaviours based on sort of the new increases in energy. So we'll be asking questions like, have you turned off your fridge recently in the past month? Have you sort of changed the kind of food that you're eating because you can't afford to cook it, or questions like that to really kind of show the lived context of people across the UK at the moment. I'm not sure we'll be able to pull out Wales specifically for those questions, but hopefully they should be quite illustrative, especially as actually at the moment it does seem to be fairly similar across the UK, which I think is quite interesting. It's not always quite this consistent, shall I say. Not that that's a good thing at the moment, but so that brings me to do a quick overview of the things that we at the FSA are trying to do to try and mitigate the issue. So taking the FSA roles I mentioned at the start, we've grouped our work streams to try and show how we're fulfilling our roles. The biggest piece of work for us is under the regulator. So we're collating a piece of guidance for community food providers, so food banks, or sort of, you know, that community group more widely. So we're not creating new regulations, I promise, but we're putting all the relevant pieces of regulation together, so in one place, so it's simpler and easier for food banks and community food redistributors to kind of understand what they need to do to kind of make sure their food is safe, to make sure that they're meeting the regulations, and to make it really clear, because we had a lot of feedback that actually our guidance is kind of not really targeted to the community sector, and we've not really engaged with this sector before, so we're trying to work out what we can do to make it that bit simpler. So hopefully that will be published in the next couple of weeks. It's currently with some of our stakeholders at the moment who are giving us some feedback. But we're also working with food donors to understand whether there are any blockers to food donations, especially when it comes to healthier food. So my experience at my local food bank is the retailer-based donations are very sort of carbohydrate heavy, mainly donations sort of from their on-site bakery, and healthier donations are really only coming through from the wholesalers. So we're doing some work with the supermarkets, who obviously we have a good relationship with because we're their regulator, to kind of understand what the issues are they're facing. Like, can we do anything to try and unblock things? Is it around confusion? And we can try and make that less confusing to try and make that a bit easier. And hopefully, well, you may have noticed that some supermarkets are already choosing to remove the unnecessary best before end dates on some of their products, which is really good news as well. So on Watchdog, we've got a dedicated national food crime unit who are looking at how the cost of living may potentially even act as a stimulant for new ways to commit food crime. So we're looking at A, like whether we expect it to increase, and B, how can we spot this? How can we make sure that, you know, animal byproducts that shouldn't be making their way into the food system aren't, and making sure that we're on top of that and kind of thinking ahead and sort of trying to be proactive rather than reactive. And obviously we of course have evidence generator. So this is kind of around the publishing of stats that I just talked about, and of course we have the stats on our previous page. So we're doing quite a lot of work making sure that actually, as a non-ministerial department, we are kind of making the most of our political freedom, shall I say, to make sure that people really are kind of listening to this. Like, we've got these government stats that, you know, government can't really argue with because we're following all the rules, you know, they're government stamped, but we're making sure that they are being published, that we are talking about them, and we are able to kind of work with DEFRA, work with Department of Health to make sure that this is being taken seriously, you can't, it's a lot harder to argue when you've got your own government department showing you these stats. So actually for us, that's actually one of our most kind of important role. So we're doing stakeholder mapping exercises, like working out which kind of organisations are publishing data, like making sure we fill in the gaps. We're doing a school foods pilot to understand what's happening in schools, to make sure actually that children get sort of healthy, safe, nutritious meals. And as I said, we're also working with other departments, especially in the UK government, but also in the devolved administrations as well. And in Convene and Collaborator, there's lots of kind of stakeholder work we're doing, but I've kind of pulled out specifically like making sure that we're working with the devolved assemblies, which is one of the reasons I'm here today, to actually make sure that we have a picture of what's happening across the UK and kind of actually learning from what's happening sort of in the Scottish, Welsh and Northern Ireland governments, because quite upsettingly for me, based in England, it seems to be being taken a lot more seriously in many levels. So that's kind of what we're doing. That's kind of where I'm going to leave today and say, are there any questions? Hopefully that was useful as kind of what we're trying to achieve at the moment and what our priorities are. I'm happy to do questions now or indeed later, but otherwise I will pass to Angelina as the next speaker. Thank you.
Thanks, Zina. Just share my slides. Okay, so I'm going to talk about a project that I ran. It ran last summer up until December last year, and it's called the Accessible Veg Project. And so this was really a pilot project where we were exploring the barriers and the benefits of CSA memberships for food insecure households. So CSA memberships, CSA refers to community supported agriculture, and really what I mean is the direct purchasing veg box schemes might be a more common way that you would recognize it. So this work, I just move my slide. There we go. Yeah, so here it is. Community supported agriculture is an agroecological model that has people, the planet, and the producer at the core of their value system. They can and do play a pivotal role in transforming the sector by contributing to the community and making healthy and sustainable food accessible. And I'll go into that a bit more through the talk. The COVID-19 crisis highlighted the risk factors that are associated with an unhealthy diet, as I'm sure many on the call are very much aware of. And the cost of living crisis now puts already vulnerable people at risk of malnutrition and related impacts of poverty, such as mental and physical health issues, loneliness, etc. But to give a little bit of background into the Accessible Veg project, this really grew out of another 2-year large research project that I ran from 2019 to 2021. And that was looking at the impact of building relationships back into the food system. You know, since for the last 50, 60 years, our food supply chains have grown longer and longer and longer, and people have become disconnected with where their food comes from and who grows it. And as a result of that, different values and norms that people may have around their food get displaced from that system because there's no longer a means of understanding how that food is grown. So we were interested in seeing what happens if you build those relationships back into the food system. Can you get healthier and more sustainable outcomes? And what we followed households that had just recently joined a veg box scheme, and we tracked their diets, we compared them to control households. And one of the interesting findings that came out of that is that those households who had recently joined a veg box scheme, their diets were much closer in alignment with the Eat Lancet diet, in that they were consuming more vegetables, more legumes, they were consuming less fat, less sugar, and less meat. And overall, their the associated carbon emissions of their diet was about 30% less. So this was really interesting for us. We saw that it is within the British appetite to consume diets that are lower in emissions and healthier as well. But what we wanted to see is, because what we know is that veg box schemes are very much white middle class phenomenon. And so we're interested to see, do these benefits extend to a wider, more general segment of the population, but also do they extend to food insecure households, and hence the pilot project Accessible Veg. So in this project, we were looking at how membership within a veg bag scheme impact food insecure households. We were looking at what the barriers are to participation in veg box schemes, as well as the impact of membership on building relationships. And we were also very interested in working with our CSAs. So these are the farms that run the veg bag schemes, working with them to test out and implement solidarity models that they could take forward after the conclusion of the project to make vegetable bags accessible for their members in their community. So what we did with the project was we recruited um, 48 food insecure households across 4 different areas that were within the vicinity of one of our 4 farm partners. We also worked with our farm partners to partner up with a local food aid charity. Now, this wasn't successful in each of the cases. It was varying degrees of success, those partnerships. So 2 of our farms were able to partner up very well with a local food aid charity. One farm partner just wasn't able to identify a local food aid charity in their area. And a 4th partner, they worked together with the council. So I should say that these farms were spread. One was in South Wales, 2 were in Mid Wales, and 1 was in North Wales. So pretty good spread across Wales there. So through these it was the food aid partners in many of the cases who were able to identify the food insecure households to participate in the study. So we provided weekly veg bags for all of the households participating. We conducted an interview before they received their first veg bag, and then we conducted another interview again towards the end of the harvest season, which was about the end of November, beginning of December time. And we also had a workshop with the farm partners and the charity partners after the Christmas holidays in order to share experiences of what worked well, what didn't work well, and what they're building going forward in terms of solidarity models. So some of the key findings that we had. So we found that for the food insecure households, there's generally a lack of information, knowledge, and confidence about using the vegetables. There's also a lack of transport to collect the veg bags as a side effect of poverty. Now, many of our partners, they worked around this by dropping off the veg bags at participating households. And then we also found that there are often multi-layered mental health problems and other issues for our food insecure participants. They chaotic lives with many daily issues, often around childcare or caring for other members in their household, mental health and other health problems, and stigma generally around being needy or poor. So these were some of the things that we tried to take into account in terms of the design of the project. And so hence we had our farm partners were able to drop the veg box off. And then in terms of the stigma, they were members of the CSA like any other member. And they participated in the different social media in the same way that any other member of the veg bag scheme would. So what we found was also an improvement in food security for these households. So we asked the typical questions in terms of the last month, if any of the questions in this diagram applied to them. And statistically speaking, we found that there was an improvement in food insecurity from the beginning of the program to the end of the program. But one of the more interesting results, I think, is that receiving a veg bag significantly improved the well-being of participants. So we saw, you'll see there before and after. So it's roughly about a third of a point improvement on a scale of 0 to 5 in terms of well-being. So this was based on a 14-point questionnaire, questions about in the last week, have you felt da-da-da-da-da-da. So what we found interesting about this and what we connected a lot of it to is to a sense of community. Participants felt connected to the veg bag scheme and the cause even when they did not visit the farm. So we had 60% of our participants weren't actually able to visit the farm. However, 70% of them said that they felt connected with the farm. So that means even though they weren't actually visiting the farm, they were still had a strong sense of being a part of that community. And this was a positive thing. We link this in part to the increasing trends in loneliness across British society. And so what we then we also asked questions around solidarity models from the perspective of participants. And so there are 3 different types of solidarity models, and there's quite a mixed response across that. You know, you could have a sliding model where households pay what they can afford to pay, or you could have a model where you could work on the farm to receive a discount from your bag. That was quite a divisive one. People were either very much supportive of it or very much not in support of that. And I think that had to do with the availability of time, really, just because you're food insecure doesn't mean that you have time available to be working on one of the farms. And then a third one would be a subsidy base, so either charity or funding dependent to cover the cost of the veg bags. And that could be things like Healthy Start vouchers, for example, if we think about the processes currently available. So just to kind of skip to the key policy recommendations that come out of this, it's thinking about quick funding for small projects and initiatives and best practice projects, because with these farms, they were able to test and explore solidarity models in that first year. And the cost from a research perspective, to cover the cost of those bags, it was typically between £500 to £1,500 to cover the cost of the veg bags. And that meant then that the year following, 2 of our farms were able to implement solidarity models and to continue providing veg bags for the food insecure households going forward in a sustainable way. So they weren't reliant upon funding from the research project, for example. Another one is about developing sustainable food partnerships that support local partnerships between actors in the food systems. So for example, the Sustainable Food Places Wales, and Chris is going to talk more to us about that in a moment. Another recommendation is the use of Healthy Start vouchers for veg bags and further pilot projects that interlink health, community, environment, and agriculture. Coordinating and funding links to existing government policies, because we've got a number of different policies out there. They're not really linked up themselves. They're quite sectoral, like Healthy Weight, Healthy Wales policy on the one hand, and on the other hand, we've got our sustainable agriculture scheme that's in the process of being developed and published, and linking those different policies up so that one approach can address sustainability and healthy diets at the same time. And then also looking at the value of sustainable funding commitments to provide long-term support for community-based initiatives. So this is a lot of the funding that comes through from Welsh Government is in the form of 3 months, 6 months, maybe even 12 months. But it's quite insecure funding stream, and what we tend to lose a lot of capacity out of the system when really good people have to go take jobs in other sectors or other places, and because of the insecurity of the funding situation. So a more sustainable funding commitment. And then finally, support and funding accessible to people that experience multiple vulnerabilities, often linked to poverty. So we've got food and fuel insecurity, mental health and physical health. That was a theme that came up over and over and over again with our participants. So I will hand it over to Chris, who will talk to us more about sustainable food partnerships.
Thanks, Angelina. That's really interesting and definitely connect with a lot of what you're saying there. Yeah, I've got a bit of a cough today, so apologies if I have to mute myself. Right, yeah. Pnawn da pawb. Yeah, I'm Chris, Sustainable Food Coordinator for Blaenau Gwent Food Partnership. We're a partnership that is a public services board programme of work. We're unique in Wales that we're hosted by the Housing Association Tai Calon. And on the steering group on the partnership sits GAVO, the Health Board, Natural Resources Wales, and Blaenau Gwent Council. And our parent organisation is Food Sense Wales, and they're a devolved national member of the Sustainable Food Places UK network of local food partnerships. And yeah, if you go on their website to find out more, I don't have time to give you the ins and outs on Sustainable Food Places, but it's about forming a cross-sector food partnership, which we've done to take a place-based approach for improving the food system in the area. So if I talk a little bit about Food Sense Wales and the work they're doing, they're championing a food partnership to be housed at every local authority. Currently, we've got 8 food partnerships in Wales, and recently there's a really encouraging announcement from Welsh Government from their cost of living summit, where they've announced £3 million package, some of which to be used to support and development of these food partnerships. So that's a really exciting development. And then on a wider context on the policy, we've got the food bill for Wales draft is going to the Senedd at the moment, and that seeks to strengthen food security in Wales through a number of measures, such as a food commission, strategy, targets to achieve food goals, and put into law that every local authority should have a food plan, and that's developed with the support of key organisations such as health boards, local authorities, local food partnerships. So yeah, in Blaenau Gwent, like everywhere else, we're suffering from a compound of crises. First we had the pandemic, now it's food and energy prices, stagnant wages. As you know, these factors are most keenly felt in areas of socioeconomic deprivation, and this in turn impacts on public health. Unfortunately, in Blaenau Gwent, we're often top of the table of all the tables you don't particularly want to be top of. And yeah, I've just got some stats up there. This inequality is reflected in the child measurement survey, the first since the pandemic, which correlates to what Angelina was saying earlier, that we've had unhealthy behaviours during the pandemic, and this is the first evidence we've got. 19.8% of 4 to 5-year-olds reporting as obese. That's I think it's about an 8% jump from pre-pandemic levels. Food bank use has rocketed. Trussell Trust have had an 84% increase since COVID, which just goes to show the crisis we're in at the moment. Alternative food bank provisions they're struggling to get provisions and donations that they rely on. And at the Housing Association, we're issuing far more food bank vouchers on a daily basis than we would regularly do in a week previously. So yeah, the Blaenau Gwent Food Partnership, how we're addressing some of these things is through a food plan, which I mentioned earlier with the food bill draft, and that's sort of centered around 6 themes, and yeah, so we're addressing the root causes of food poverty. They're all also linked together, but this is the one we're talking about today. And yeah, as I'm sure you're well aware, the mechanisms for food security are vast and requires a whole systems approach. Ideally, as Zena said, yeah, it's a poverty problem, so we'd want to see its way to vulnerable households. But what the food partnership tries to do is sort of build in this underlying support where we can take the systems approach, maybe identify what is needed in the community, whether it's cooking equipment, cooking skills, sharing meals, building strong networks and to improve this food security. We've also got to look at how can we address not only the causes but the effects. And I really like this sort of way to communicate this through food ladders. This is from Megan Blake at Sheffield University. So in a blind and Gwent context, we're looking to build on this theme of community food resilience, where people find themselves in need, and the community groups that we're working with are that safety net, and become those support ladders. And at this point, we want to add in rungs to the ladder. Well, you know, all know how a ladder works, but yeah, add in these rungs and build capacity and help people and places transition to a situation where they're less vulnerable. So this looks like providing signposting services, making sure that these community food organisations are more than just a point of food access. And then hopefully through that we have a strong enough community that we can remove the barriers that are disempowering communities and shift to a context of community empowerment. So the food partnership work, how it works in action. So we built a really strong network of community food organisations who meet regularly, and we share best practices and network, and just a great way to join up the dots. And as I'm sure in your communities, the mutual aid response from COVID was really amazing. And just sort of linking those groups up and just having that conversation, and making people aware that there's this support network and how we can maximize the work we're doing. And the people we're working with are facing some really difficult situations, some terrible stories you hear. So just making sure that we're giving these groups the voice, so they're heard, they've got the platform, and the food partnership is like an ally to their work. And yeah, so it's sort of that sense of connection and being heard, and making sure that those supposedly hard to reach groups are not that hard to reach, and working to make sure that they get the funding, as well as maybe the more traditional groups who are quite savvy at accessing funding and know where to go for it. And one thing we're really looking to do is that sort of, like I say, that whole systems approach where we work with groups to have consistent messaging across the board. So what that might look like, for example, is our Healthy Start project. We've tried to piggyback on the digital transition to make sure that we're getting into the frontline staff and volunteers, so everyone's up to speed, and we're getting consistent messaging across the board to raise awareness across the borough. And that's developed into some really good working practices, like with Flying Start. And then we've worked with the local greengrocers to provide vouchers that double ups on the Healthy Start scheme value, so people can access local fresh fruit and veg in their area. Yes, so there's lots of challenges, as you can imagine, as I think Zena touched on. Yeah, the sort of something that really is difficult to juggle in a lot of these spaces, that we're at the mercy of the food waste supply chain. So unlike with the Trussell Trust, where they have a sort of nutritional standard, a lot of these alternative food pantries, they might not have the emphasis on good nutrition. So, for example, if Greg's overproduced donuts to keep customers happy, and know that the local groups will collect them at the end of the day, so that those donuts go into the community, but and then we're seeing the effects on that with the child measurement survey I mentioned earlier. But at the same time, if you're experiencing food insecurity, but like food can bring you a lot of joy if you get those treats. So it's sort of a difficult balancing act to have. So what we're doing as a group is trying to make sure we can fund what we do fund, or what we can access for people, is that they seek good quality nutrition to make sure that's well supplemented, and we've done that with local food co-ops and food pantries to get them connected up with fruit and veg bags. And yeah, the food supply chain is vulnerable. We see from global economic shocks and pandemics and climate change that the global food supply is fragile. Whether groups are reliant on fair share or end of day surplus, it's likely that you're going to be sharing that resource with a number of other groups in your area, which can be a source of conflict. And one thing the partnership does do well is sort of to negate, not negate conflicts, but sort of, try and break down those barriers with competitiveness. And I've spoken about how useful funding is, but it's got some downsides as well. That my worry is that I might be a parent-child sort of relationship with it, and I want to sort of have that more co-creative way to build food resilience. Because taking on a food support project it's a lot of work, there's a lot of logistics, and like even from a food safety element, from a administration and sort of volunteers and all the work that goes into it. So some groups are chasing the funding to sustain their model, and then it might need a bit more support from me than I was hoping for. But so yeah, just trying to develop that sort of community independence, some self-organize, like we go back to the food ladders, this self-organizing sense of community where they're progressing forward. And often with funding, you often hear about it last minute. There's short deadlines. You have to get X amount of money spent by March the 31st, and you've got to do this and do that. And what we need is sort of sustained long-term funding to really help groups develop. So I've got a few examples to show you of some groups that have really taken that on board and really developed those support networks through the funding and through the partnership. Thanks, Ralph. That's very kind of you. Twice. There we go. Okay. Yeah, just conscious I'm over time now, but yeah. So yeah, just some really good examples of how we're building capacity and support through the network. And yeah, if you have a local food partnership or you want to collaborate with yours, then none of this could happen without the strong network and the partners getting involved. So get in touch with your local authority or your partnership to see if you can build one. Thanks.
Fantastic. Thank you so much. Some really, really inspiring and interesting presentations. So thank you. If you've got any questions, please feel free to put them in the chat. Don't be shy. I know that Angelina, Chris and Zena all, I wrote down millions of questions, so I'm sorry you won't be short of them if nobody else decides to. Okay, so we have one question in the chat already, and it's from Jill Simpson. Angelina, it's for you. So how were the 4 farms chosen? Would they be called small producers, and were they organic, etc.?
The 4 farms were chosen. We put a call out through some of my practice partners, so Social Farms and Gardens and Food Sense Wales both sent it out through their networks, and we had 7 farms initially express interest, who I followed up with, and ultimately it was 4 farms who had the capacity to engage with the project, and they were all agroecological. I'm not sure of the 4 how many were certified. I know off the top of my head that 1 was certified organic, but I'd have to actually check the details to see if the others are certified or not. So yeah, it was just, and all 4 of them, when they came when we worked with them, they all were very keen on building solidarity approaches into their veg box schemes, because they'd all seen during the pandemic members of their veg bag schemes came forward to them and could no longer afford the veg bags, because of changes in circumstances. And they felt strongly that the food they grow should be available for everyone in their community, not just for those with a certain level of income. So I think that was a really key part of the project, was that everyone really believed in what it is that we were working towards.
Oh, that's fantastic. Yeah, because sustainability is something like ongoingly from the project that I wondered about, and then so you've kind of answered that. Did the number of participants remain high afterwards? Have you evaluated the project?
So we haven't gone back to see this year how many are participating. I know with so 2 of the farms have continued. They've built in solidarity models to continue supporting the participants who started with the project. I haven't asked them to see, is it indeed all 15 or 14 of the households that continue to participate or not. One of the farms, so it was interesting. Those farms who had the really good relationship with the food aid partners were the ones that had the best results. So they had very little turnover. The households that joined from the start were still part of the project at the end, whereas one farm, the one who hadn't located a food aid partner to work with, they struggled the entire project. It was a constant turnover of participants. I don't know if any of the participants stayed with it for more than 4 to 5 weeks. And then we had sort of one in the middle, the one who'd worked with the council, and that was a little bit difficult. The communication wasn't as strong there, and so there was some turnover, some not under. There was a certain problem with the communication in that as the research team, we didn't understand the nature of the households that we were supporting. So there were a handful that were vulnerable in that they had disabilities, learning disabilities. And that didn't get communicated. So you can easily imagine how that would be problematic. And that was, I think that had a lot to do with the strength of the partnership. The stronger that partnership was, the more smoothly the logistics side of it flowed, the stronger the trust that was there between the household participants and the farms and the food aid partners. So it really does make a difference, the relationships that are in place.
We've had a couple of other questions come in now. So, okay, so first one's from Kelsey Cantelo. We have a resident scheme that grows their own veg, but they're struggling to find places to donate to. Any suggestions? So I'll open that up to Chris, Zena, or Angelina. Any suggestions?
Yeah, have a look on Facebook or Olio, or see if there's some sort of community food networks in your area where you can get in touch with someone.
Okay.
Even like your local food bank or something. They're usually, or like a community redistribution hub. I know you're not redistributing it in that same sense, but usually they're extremely happy to get veg donations.
Great.
Yeah, I think that it might also be worth asking in the school. Sometimes the schools are doing things or know of things around using the vegetables. So, and then you never know what actual other links that might create in terms of school having interest in working together with the residents growing food, because there's really great opportunities for educational links and linking children up with how food gets grown.
Yeah, because that was one of the things when I was listening to you all. It's about behaviour change as well, isn't it? And trying to influence that. So the next question, Alex Cook, what can we as organisations do to increase engagement with the end user in relation to fresh supply and combating the current challenge of decreased demand, i.e. paying customers for veg box schemes?
I think that's challenging. It kind of depends how much resource you have. And I'm going to imagine the answer to that question is very few resources for improving engagement. And I think it also depends on the nature of the organization. Again, like I mentioned about the schools can be a nice pathway into that engagement with users. And again, that's going to just depend on the school. Some schools are really thirsting for this kind of interaction and to be able to bring that into the schools. Some of them already have stuff up and running. I mean, it really is inspiring, actually, all of the different stories I've heard from different schools. And it's about, that each school having that one really motivated teacher who takes on food as their project. And then it's just incredible, actually, what one motivated teacher can actually achieve. And so I think that, in terms of engagement with customers, children is a good one because they're the future. They also then talk to their parents, and it creates more awareness at a household level as well. But I think without knowing specific, it's hard for me to come up with one blanket answer for how organizations could increase engagement.
No,
but it's about partnerships, building partnerships. Maybe it's about talking to local farms in the area.
Yeah. Chris, your partnership coordinator, any ideas? It sounds like you've done lots of this in the past.
Yeah, I was just going to pick up on Angelina's connection with schools. Is in Wales, there's a lot of big box void projects are springing up, and they're often keen to get involved with anything going on with food. So see if there's one in your area.
Zena, any of your research?
Yeah, anything more to add from Angelina? I think sometimes you just have to almost be annoying and send people emails. And sometimes, people will respond. And as Angelina said, some people are really keen to work with you and some people aren't. But, sometimes you've got to ask.
That's it. Yeah. If you don't ask, you don't get. As simple as that. Great, thank you. We haven't got any more questions at the moment, so but we're almost out of time now anyway, so I will start to wrap up. If we do get some more questions, then we will try and endeavour to answer them offline afterwards. So just want to say thank you very much to our presenters, to Chris, Angelina and Zena, for your really interesting presentations. Thank you. And for everybody attending, like we said, this has been recorded and will be available online on the Public Health Network Cymru website soon. We will put an evaluation link, or we have done, in the chat, so we would love it if you gave us some feedback, please. I know it's easy, we all intend to, but then we move on to the next meeting, but I do think it's really worthwhile. And if you've got any ideas about future webinars, then please put those to us as well. So with that, I will let you all go on about your day, and thank you very much once more. Diolch yn fawr iawn. Thank you.
Thank you.
Cheers all.